I have to talk about Transmart. And this is a pre-competitive data sharing platform that's being used by pharmaceutical companies, by biotech, academia, and the FDA in the US. It first started in England under the IMI, where they put up 1 billion euros, and pharma put up 1 billion euros. This is run out of the transmartfoundation.org, which is at the University of Michigan Medical Center. And I have to read Jen's whole thing. The real point of this is to realize translational biomedical informatics research by sort of continuous improvement of open source. It's an open source code base, although it has IP protection for pharma. It is very good at enabling effective data sharing. We have safeguards to protect any IP, for example, clinical trial data that may be certain pharmas want to share with each other, but they don't want to share with the whole Transmart community. This is the board of directors currently, or also Eric Karaspas, who actually developed the first instance of Transmart based on Harvard's I2B2 informatics platform, is going to become part of the board as well. We have Lee Hood, you probably know who he is, this systems biology guy. And Brian Athey at the University of Michigan, a colleague of mine, is the CEO, along with Mike Braxton-Thaler Roche of the Transmart Foundation. So there's Eric, and he was the first one to develop Transmart. It's published. I don't have the literature reference here. The first instance that is actually used was for an asthma research study where GSK wanted to share clinical trial participants, but they didn't have enough people. They didn't have enough participants, so they decided, well, we're going to go into this kind of clinical trial participant data sharing group with other firms. And that really led to Transmart being realized. It's that bad, huh? Well, I'm not going to go through this. You can look at the slide if you want. You know, these kinds of technical architecture slides, although I love them, I think probably 99% of people here think they're relevant and of no interest, but essentially it has all kinds of inputs. The focus is really on really two areas: genomics, next generation sequencing, and bioinformatics, and I would say as a third thing, computational biology. It also has a clinical trial participant data sharing component to it. We use standardized ontologies and taxonomies, consistent with what the FDA uses and what other people use. As you know, I don't know if you know this, but there are about 578 ontologies currently used in biomedical informatics. You can go to NCBO if you want to see all 578 of these ontologies, which is insane. It's sort of like the open source bioinformatics software community. You get 10,000 free applications if you want. So we do mining and we also do querying. This is an instance that has been developed by something called One Mind for Research. I don't know how many people here have ever heard of that. Okay, Brent has, a couple of people. So it was started by Patrick Kennedy, and actually his notorious cousin, William Smith Kennedy, if you know who he is, and funded by somebody who owns a vineyard in Napa. And it's very focused on working with NINDS on neurological diseases. So essentially, if you're the user here, up here, does this have a pointer on it, or it should? So if you're the user here, in this instance, you can use all these tools, including statistical analysis program, gene pattern, haplotype, GeneGo or Go, Pathway Studio, which is for mapping pathways, and you can go into the basic I2B2 data mart, and do searching and curation and use a bunch of source data. So here are the adopters since the Transplant Foundation got formed. This is as of about a month and a half ago. E-Trix, which is funded by the Innovations Medicines Initiative in England. They put up 24 million euros. A group consisting of Janssen, Millennium, Sanofi, and Pfizer put up a bunch of money at the University of Michigan, Johns Hopkins, and the Brady Institute of Urology. One Mind for Research. The U.S. Food and Drug Administration has several instances of Transmart running inside of it. And there I am at the bottom, Sure Excel. And I'm going to stop there because this woman came up here and I think I should stop talking, okay? Any questions? Yes.
Can you add additional statistical packages like R to the analysis?
Yes, in fact, I was actually, when I talked about SAS, I was going to say something about R, but I decided, well, probably in this crowd, I probably shouldn't denigrate SAS, because I'm more an R person, bioconductor, I'm more a bioinformaticist. So that's all in it. By the way, Thomson Reuters, PerkinElmer, Spotfires, they've all donated this, all of their applications for this. There's a faceted search that's been provided, so it has a whole bunch of features that I did not show. Go to transmartfoundation.org if you can. Yes?
Using clinical ontologies to actually link this to real clinical data, like SNOMED, long target tomorrow?
Yes, absolutely. I mean, I use OWL-S, which is a web, if you know what that is. And to some extent RDF, because I have an appointment at the Mayo, so I have to, with Chris Shube, I have to use that.
We do have a
Brent?
Q&A time at the end, actually, if we could pull on.
Okay, I'll show you.